Okay, now this work is also published in Current Oncology in spring this year. Oncology nurses' attitude, knowledge, and practices in providing sexuality care to cancer patients, a scoping review. Again, the same folk, but Professor Maha Subik was the mentor and supervisor for Oma at the time of writing this paper. So she is one of the co-authors. So she's also in Altoona, University of Jordan. Next slide. Again, published in Current Oncology, impact factor now rose to 3.4. Again, if you email Mr. Omar Gazi, he will send you the paper very gladly. You can also search the spring issue for Current Oncology, put his name or my name on, you likely can find the paper. Next slide. So no introduction again. This is a male nurse from Jordan who have special expertise in sexual health, pain control, sleep quality, and also patient satisfaction. And you know that his master thesis has won the best thesis among all the master students, counting all faculties like accounting, nursing, everything together, all the master students. He won the best thesis award, which he received in October. So this is a very bright man. Next slide. Cancer is the second leading cause of death worldwide. WHO said in 2022, estimated 20 million new cases, 9.7 deaths occurred. And, according to the WHO, sexual health is an integral component of well-being. It affects the quality of life across physical, psychological, and social dimensions. Next slide. Cancer can disrupt daily life. Because both the disease itself and the treatment can lead to loss of sexual desire, poor body image, and impaired sexual performance. Next slide. So sexual health information can help patients to reduce anxiety related to sexual concerns like the satisfaction. Understanding the nurse's own attitude towards sexual health is important. We can provide them with adequate training that can improve cancer care. Cancer patients have sexual health needs, and unaddressed sexual dysfunctions will significantly reduce their satisfaction, regardless of age, sex, or comorbidity or cancer type. Next slide. So again, 4 major electronic database have been searched. This time is Elton B. Stephen Company database. Again, the Altoona University have this one. I don't know whether University of Saskatchewan have this database. The others are very famous, like Scopus, Science Direct, and PubMed. And Prisma methodology has been used, but this is a scoping review. So it's different from systematic analysis. Okay, they have different criteria and questions to answer. Next slide. So there were initially 1,700 studies, and then there are duplicates, and then Mr. Omar check out which one is relevant to this sexual nursing attitude. And finally, 11 papers satisfy the criteria. They are quantitative and qualitative survey or quasi-experimental interventions, and also concept mapping studies. Next slide. Can you please put on the next slide? This is a flow diagram, very typical, a prisma diagram. Okay, so there are elimination of duplicate record, like 600 of them, and there are 1,000 records that are not really related. And then there are some not satisfying the inclusion criteria, like 49 of them, finally leaving only 11 studies that we have to discuss in the coming few slides. Next slide. So various barriers will hinder nurses from providing excellent sexual care. They are personal discomfort, don't want to talk about sex at all. They don't have time. There's the cultural sensitivities. You're afraid that you offend the patient by talking these private personal matters. Okay, next slide. So what are the practical tips? Well, if you read our paper or that you think about it, we put up all these PowerPoint that I'm sharing are already on ResearchGate, so you don't need to take down any notes. There are several facilitators that could help nurses to provide better sexuality care. Educational workshop is one. To develop structured tools and guidelines. I told you that the nurse can take sexual history in a special format. So that is a sort of structural tools. The third way is a nursing chronicle that is focused on the sexual health care. And fourthly, supportive environment. You want to have a private room. You don't want others to walk in. Okay, next slide. Now, 3 studies have highlighted a significant knowledge gap among nurses. Although nurses recognize themselves that sexual health care is important, they themselves have limited understanding. They feel embarrassed. Time constraints. I told you there's no time for them to go to pee in bathroom in some busy emergency room. There are cultural barriers. They don't know the right word. You know, I never know that the word buttock is actually offensive in Canadian culture until a radiation therapist told me in my second year of working in Canada that is a very rude word to use. Buttock, the word. We think that it's something so simple. It's not. Then later on, I think it may be easier just to use the word bum. How is your bum feeling today? Just an interesting example. So attitudes are significantly influenced by cultural factors, like in Turkey. They often perceive cultural convention will be the barrier to talk about sex. Next slide. Our report supports several previous studies in the existing literature by addressing knowledge gaps to provide cultural appropriate solutions and to establish a framework for enhancing sexual health care. And there is actually a previously published paper from the Altoona University that illustrated cultural taboo surrounding the discussion of male sexual impotence. Like, in intensive care, if you ask the patient about their concern, they ask and ask and ask until at the very end they will tell you, I'm afraid that my penis will not erect after all these treatment. But it is set by the patient to be the last item, but in his mind, it might be the number one, but he's just afraid to talk about it in the very beginning. Okay, next slide. So improving the nurse's attitude and belief towards sexual care will require targeted interventions like training programs. And there are observations that are consistent with the following authors like Young and Kim et al. And also Erican. They have recommended the use of some formal sexual health care nursing note. It's like a structured note. What exactly is the issue? Would you mind to share with me? Like an inviting attitude. Next slide. So this scoping review published in Current Oncology have valuable references. You might want to read it. It highlights a very important, significant issue that actually is seldom published. And, this work has been prepared by Mr. Ogaisi, who himself had about 10 years of nursing experience. Some of them, obviously, in the emergency room. Some of them are in orthopedic ward. And then in the recent 7 years or so, he's working in a cancer clinic. So then the researchers, like I am from China, and so is Professor Edward Yu. Professor Kurian Joseph is from India. All these are very conservative societies, and we have been deeply ingrained by the religious that it would render discussion about sex a taboo topic. Next slide. In conclusion, sexual health is often ignored in cancer care. In the paper, there are lots of detailed methods about the cultural and the communication barriers. This particular PowerPoint or this talk, I just point out a few of the more important things because there's no way that I can cover everything within the time frame. And education will improve the nurses' confidence, their skills. Therefore, short sessions and time-to-time reinforcement, like a continuous medical or continuous nursing education, as a reinforcement is important. Cultural competence would enhance patient trust. And if the patient feel that they have a good rapport with the nurse or the doctor, they will open up something that had deeply in their mind, but dare not to tell anybody about. Next slide. Now, implication of practice will be, number one, improve oncology nurse knowledge of sexual care, and the scoping review would suggest integrating comprehensive sexual health education into existing or those so well-established nursing and medical school curriculum. And it needs to be in a continuous education programs with an emphasis on multicultural competence. What if you are, say, Russia? Well, they are Orthodox Christians, so they may not be quite open to talk about sex as well. Although, in general, the Western society is more open to discuss things than the Middle East or the Far Eastern countries. Number two, ongoing feedback and research on the long-term effect of this intervention will further improve the education program. They will be crucial to help healthcare providers to evaluate what are the benefits, what can be further improved in the training program. Okay, next slide. So, you can find the article in Facebook, Twitter, LinkedIn. Next slide. Obviously, you can email to Mr. Ogaisi to get the original paper. Now, this Professor Maha Subik on the left-hand side, she was a supervisor for Omo Agassi at that time. And then on top is Mr. Calvin Wong. Oh, actually, he's a PhD. I should call him doctor. PhD in biochemistry. And then the lower one is Professor Kieran Joseph. And then Professor Edward Yu, it was my own teacher during my residency training 30 years ago. He was my teacher. And last but not least, myself. Next slide is only a joke. I'm a very humble person. And so is Mr. Omar Agaisi. You will like him sincerely if you have a chance to meet him. If you have questions, email him, but you can also ask me a question because I have been involved in most of his research. Thank you.